All right, so everybody's familiar with the headlines that we've been hearing recently. Boy undergoes double lung transplant in Detroit after vaping. All the deaths and lung injuries that are related to vaping and e-cigarettes. And so I don't think that this comes to any surprise. E-cigarettes are creating a generation of nicotine addicts, top scientists warn. And we'll see as we get further into the presentation how really, truly this is affecting not our generation or the generations before us, but the generations that are coming up behind us, probably more than anything. So what exactly are e-cigarettes? They have been referred to as e-cigs, vapes, e-hookahs, vape pens. Some of you may have heard Juuls, electronic nicotine delivery systems, or ENDS. Basically, they consist of a battery, a heating element, and then a liquid. And essentially, the heating element heats that liquid and creates a vapor, which is then inhaled into the lungs. And oftentimes, that aerosol that's created by the heating element contains nicotine, as well as a number of other harmful chemicals. When this vaporized liquid is exhaled, it also can be inhaled by bystanders. And so there is some secondhand smoke adverse effects as well. I think about this. I have two teenage daughters and a 20-year-old. And oftentimes they talk about vaping on the bus or vaping, in the bathroom. And it's pretty rampant in our schools. I don't know if everybody's really aware of that. So what forms do these vaping devices come in? Oftentimes they're in the traditional form. So you have your pipe, your cigar, the large size tank devices, they less resemble your traditional tobacco devices. Medium-sized tank devices, I've seen a lot of adults with those, or your disposable e-cigarettes or your rechargeable e-cigarettes, which look like your traditional cigarettes. What's more concerning to me, particularly as a parent, is the e-cigarette devices or the vaping devices that look like highlighters or really pretty pens, USB drives, those kind of things. And I think it's really important as parents that we're aware of these things. This one's my favorite, the Juul. I don't know if you guys had heard about the mother whose child frantically lost his USB drive at McDonald's. And she had mass emails out on Facebook looking for this kid's USB drive, because obviously our kids keep very important things on those USB drives, homework, papers, whatnot. He had actually just lost his Juul. And they look like they could be laying around your house and you wouldn't even know that it's actually a vaping device that our kids are inhaling nicotine products into their lungs. So what exactly is in these e-cigarettes or these vaping devices? The liquids can contain nicotine, tetrahydrocannabinol, which is THC, or the derivative of marijuana that causes the high, cannabinoids, CBD oils, other substances and additives, flavoring. The diacetyl, you talked about the Juuls, those are the ones that are the flavored vaping devices. These flavoring additives have actually been known to cause some pretty serious lung problems. Volatile organic compounds, which when heated can be carcinogenic and cause cancers, other cancer-causing chemicals, and sometimes heavy metals, including lead. And I know, as a parent, again, when the lead warnings came out and our kids were eating, well, not my kids, but probably my peers were eating lead paint, then they outlawed lead paint. I don't know if anybody would be excited about their kids inhaling lead into their lungs. So what are the adverse effects of vaping and e-cigarettes? They're still very new, so we really, really don't know. We don't really know. We don't have these long-term studies that we have with our traditional tobacco products. However, there are some things that we do know. One is that most of these vaping devices do contain nicotine. And we already know the adverse effects of nicotine, and we'll go over some of those. One thing I didn't realize, the only other use of nicotine that is known is it's been used as an insecticide, and it started in the 17th century. More recently, the use of it as an insecticide has declined, and that's mostly because they're cheaper, more available, more potent pesticides that actually were less harmful to mammals. In fact, in 2014, the United States Environmental Protection Agency banned nicotine as an insecticide because of how harmful it is to mammals. Also, India, who is one of the biggest producers of nicotine sulfate, has banned it as a pesticide or an insecticide as well. So I think that's pretty telling how harmful nicotine is to the human body. As we all know, nicotine is an extremely addictive substance, and many of us have heard that it's more so addictive than cocaine or heroin. And I've had patients who've used cocaine and who've even been prior meth users and have said it was harder to quit smoking than it was to quit using meth or cocaine. So I think that that's pretty telling as well. So we know that nicotine is toxic to developing fetuses. It causes intrauterine growth restriction, stillbirths, miscarriages, as well as developmental delays of our unborn children. And nicotine has also been known to cause pediatric asthma as well. And this, of course, is also very important to me as a parent, is that it actually can delay the development of the adolescent brain. And we know more and more about the development of adolescence, and the adolescent brain develops up until age 25. And this is also very, very important as we talk about who's actually using these vaping devices. Okay. So other adverse health effects, nicotine has a very, very devastating effects on the heart and vascular system. It's known to increase heart rate, blood pressure, cardiac contractility, reduces blood flow to the blood vessels, and really, in essence, it causes acute myocardial ischemia, which is basically a heart attack every time you smoke. Every time you ingest nicotine, you're reducing the blood flow, the oxygen to the heart, and essentially inducing basically a heart attack or ischemia to the heart. It alters the structural and functional characteristics of the vascular smooth muscles and endothelial cells in your blood vessels, which can cause hypertension and other vascular disorders, peripheral vascular disease, all of those things. In the reproductive system, it leads to the impairment of nitrous oxide synthesis, which can lead to erectile dysfunction in men. Nicotine also decreases testosterone levels, and it disrupts the development of sperm cells in men. In women, it can disrupt menstrual cycle. It causes endocrine disruption, as well as disrupting the development and maturation of egg cells. So, and that's a big deal, especially when we look at the age groups again who are really using these devices. It can affect the central nervous system. It stimulates vagal reflex, which can cause damage to the airways, in the respiratory system, and increases airway resistance. It also can lead to the decrease of elastin in the lung, which can lead to emphysema. And this is just nicotine in the system. It doesn't necessarily have to be inhaled into the lungs. And so I think that's important to know. It causes a decrease in your immune system. So people who smoke or use nicotine or vape are immunocompromised. And then, gastrointestinal, I skipped that one. It does lead to esophageal reflux disorders, heartburn, those kind of things, as well as peptic ulcers. And then it also promotes tumorigenesis by affecting the cell proliferation and angiogenesis of apoptic pathways, which basically causes all kinds of cancers. Not just relegated to lung cancer, but it can cause pancreatic cancer, breast cancer, gastrointestinal cancers, and the like. And so clearly, nicotine is a harmful substance in these e-cigarettes. Uh-oh. There we go. Okay. So other, aside from nicotine in the e-cigarettes, they have cancer-causing chemicals, tiny harmful particles that can be, inhaled deep into the alveoli of the lungs, THC and CBD oils, which we talked about, and then finally vitamin E. And this is what we're really finding out in terms of the acute lung injury related to e-cigarettes. So vitamin E acetate. In the 29 samples sent from the bronchoalveolar lavage, or when they cleaned out the alveoli in patients with vaping-associated lung injuries, all of them contained vitamin E acetate. And this is an additive that vitamin E, we think, well, that's good for us, right? We put it on our skin, we ingest it. We've been told by healthcare providers that vitamin E is good for us. It's not good to be inhaled into your lungs. And clearly, in all of these people with vaping-related injuries, lung injuries, they found this chemical from cleaning out the alveoli. And what they're finding is it's an additive that they use most often in THC-containing e-cigarettes or vaping devices. And it's just used to thicken the liquid. That's all. So that's pretty much what they're finding. This is clearly a cause of vaping-related injury. However, it is not solely the cause. And so we can say we've identified vitamin E as something that can be very harmful when inhaled, but there are other harmful substances in these e-cigarettes that have not been identified yet. So, interferes with normal lung function. What they say is it causes a sticky coat in those little pockets in the lung where the oxygen exchange happens with the blood. So we breathe in the oxygen diffuses through the lungs, and that vitamin E is causing the sticky substance in those little pockets, and it's causing interference with the oxygen exchange, as well as flash pulmonary edema, the lungs fill with fluid, and then we have acute lung injury. So these statistics, I think, are pretty staggering so far. And this is just, e-cigarettes have been around for maybe 10 more years. There's been 2,290 reported cases of e-cigarette and vaping-related lung illnesses. The median age of these injuries is 53, but they range from 17 to 75. There's been 2 reported deaths in Montana, 47 deaths overall. I think, and really, that's quite a few for Montana when you think of the rural nature of our state. 95% of these cases that were reported were hospitalized. Okay, so of the 2016 cases that we actually were able to gather all this data, the yellow group is the group of those over 35. So the majority of these lung injuries, the blue, the orange, and the gray, are all 35 and younger. That's pretty staggering when you think about it. The orange group is the largest group, 18 to 24, and this really lines up with who actually uses these devices. Younger than 18, it's about percentage-wise breakdown, 77% of these lung injuries are under 35 years old. 15% were under 18. The large majority, 38%, were between 18 and 24, and 24% were between 25 and 34. Only 23% of the reported injuries were older than 35. Breakdown of males and females, the majority of the lung injuries reported were in males, 68%. And then this is kind of a breakdown of, I don't know if you can see this very well, the reported product use in these devices. So this is kind of a confusing slide, but in about 1,184 of these cases, they gathered what actual substance was in the vaping devices that these people were using. 83% contain THC products, and that's the yellow on the far left. 35% included exclusively THC. That's all that was in the product, and that's the second yellow bar. 61% contained nicotine with other additives or other products, and that's the middle orange bar. Only 13% were exclusive nicotine users. And then the gray bar was reported combined THC and nicotine. So 48% had actually a combination of both of those, and only 4% had neither nicotine or THC. And I think this is interesting because in my work I do a lot of smoking cessation, and I have a lot of patients who vape, and they say that their vape doesn't contain any nicotine, which we're finding out that what's advertised as not containing nicotine actually has some traces of nicotine in it. But they're using it as a cessation device, but really, kind of as a false kind of security that it's safer than cigarettes. But anyway, so that small percentage there didn't have either nicotine or THC in it. Okay, so who uses cigarettes? I think this is probably the most surprising and important slide today. In the United States, youth are more likely than adults to use e-cigarettes. In 2019, over 5 million US middle school and high school students are vaping, basically, or reported that they vaped in the last 30 days. This included 10.5% of middle school students and 27.5% of high school students. And I will argue that this is an underestimation of actually what's going on. So in 2017, 2.8% of US adults were currently using e-cigarettes. So think about that. I mean, there's a large percentage disproportionate percentage of youth are actually using e-cigarettes. In 2015, among adult e-cigarette users, 58.8% were also current regular smokers. And so this is a big thing here, because people say, what do you think about using e-cigarettes as a smoking cessation method? I say it's not the safest, clearly, and I don't believe that you will quit smoking. I believe that you will use e-cigarettes and smoke, and that's usually what happens. And that's why, and we'll get to this too, the CDC actually doesn't recommend using e-cigarettes for smoking cessation, and a large part of that is because it leads to concurrent use or dual use of both regular cigarettes and e-cigarettes. So, 20, well, also current regular cigarette smokers, 29% were former regular cigarette smokers, so there are some who moved to e-cigarettes, and then only 11% had never actually used regular cigarettes, they just started vaping. So, and this is adult population. Among those 45 and older, in 2015, most were either current or former cigarette smokers. In contrast with the youth population, who they just go straight to vaping. And I think impartial, it's due to they think it's safer than cigarettes, or they think it's, there's some of that kind of security. And also I think that they're probably more available, and we can talk about some of that too. I feel like I have the inside straight on how these kids get these, but I don't think it's hard. You have 18-year-olds in your high school who can legally buy these things, and they have friends who are younger. And, So anyway, so are e-cigarettes less harmful than traditional cigarettes? Yes, technically they are. We could say that a regular cigarette has 7,000 harmful chemicals that have been identified. An e-cigarette has less. So how much less harmful is it? I don't know. Probably not a lot. E-cigarettes can and do contain harmful and potentially harmful substances, which includes nicotine, heavy metals, including lead, volatile organic compounds, and other cancer-causing agents. And really, the vapor in e-cigarettes is not harmless. And so I think that's really the take-home point. So using e-cigarettes as smoking cessation, I already kind of touched on this. It is not approved by the FDA. There were some things out there that they talked about e-cigarettes possibly being a tool, and the CDC possibly recommended it as a tool, but really it's not a safe alternative. And there's lots of other good smoking cessation methods that we can use that are safer. The evidence is insufficient to recommend them as a smoking cessation tool, and essentially that's what it comes down to. We talked about how it can lead to dual use, so a lot of times people end up using vaping devices and smoking, which is clearly not good. And then the final thing that the CDC always would really like to emphasize, however, is that they don't recommend, if you have transferred to a vaping device for smoking cessation, do not go back to traditional cigarettes. They don't recommend, if anything, try to quit the vaping device, but they certainly don't recommend reverting back to using traditional cigarettes. So, more adverse health effects. These are some kind of aside, and a lot of these incidences seemed like they were isolated and kind of, but I think it's important to be aware. These vaping devices can cause fires and explosions. And I apologize for the next picture, but this is a teenage boy who had a vaping device explode in his mouth. And clearly, I'm sure his parents weren't thrilled about the dental bill or the reconstruction of his jaw and all of those things. But clearly, they can cause some significant damage. And we all have been on on the airplane when they say, make sure you don't have your vaping devices in your baggage because they can explode. I think that's. So CDC recommendations, this is kind of to minimize risk to people. Do not use THC-containing vaping products. That's one thing that they really emphasize. Never buy your vaping products from informal sources. Always know what's in there. Never modify any substance in your vaping pen or whatever vaping device you use. And really the only way to assure that you are not at risk from vaping injury or vaping products is to refrain from them altogether. That's the biggest thing. Current users should always carefully monitor their signs and symptoms for any of the acute illnesses that could occur from using vaping devices. Cough, shortness of breath, and chest pain are pretty hallmark signs of vaping injury. Nausea, vomiting, abdominal pain or diarrhea, fever, chills, or weight loss. And so, and as practitioners, it's good to monitor for these things. Always ask your patients if they've vaped or if they use the vaping devices, just as you would ask them if they smoked. This is one thing, too, that I think is really important, is we sometimes as practitioners, we think, I ask my patients if they smoke, but in the patient's mind, they say, well, she didn't ask me if I vape. No, I don't smoke. So it's really important to make sure you ask all the questions. In summary, although safer than traditional cigarettes, they are really not safe. So our recommendation is don't start if you haven't already. And if you have started, try to quit. We do not know the long-term effects of e-cigarettes, and a lot of this is, it's no different than regular cigarettes. I feel for a lot of my patients. A lot of them are World War II vets or Korean vets, and they were handing out cigarettes as they were coming off the boats, and we didn't know the adverse effects of smoking, and now they're paying for it. And so I think we're smarter now, and I think that we do know that there are going to be adverse effects to vaping, and so our kids don't really have an excuse. The majority of new users are youth and young adults. I think this is a big deal. When you look at the adverse effects and the long-term adverse effects, especially on things outside of acute lung injury, when you look at cardiovascular effects and those kind of things. Vitamin E has been identified as a harmful additive, but there are also other harmful chemicals that haven't been ruled out. And so just because your vaping device doesn't have vitamin E in it, doesn't mean it's safe.